Hi, everybody. It's such a privilege for me to have the HPV Alliance host today's important event in partnership with the Moffitt Cancer Center and Advent Health. You know, things have come a long way since Farrah Fawcett's tragic passing from an HPV associated cancer. A lot of resources have gone into both research and education in this field, including some great work by the Farrah Fawcett Foundation, who is one of our mission partners in today's event. Now, personally, what I want to say is, HPV is that sneaky little virus, and many of us don't even know that we have it. It kind of creeps up on you, takes years to manifest, and then all of a sudden, somebody wakes up, they're 50 years old, and they have HPV virus. They have a cancer, and they had no clue. And this is something that we're very passionate about in terms of getting out the education and the awareness all about HPV. I want to share a story of how I met Marsha Cross and how we came to launch the HPV Alliance. I saw a social media post back when I was just finished with my treatment, and I couldn't believe that Marsha Cross had the same cancer that I had at the same time. And I said to myself, I have to get in touch with her. And lo and behold, through a mutual connection, we got in touch. And it's just been unbelievable since day one being a partner with Marsha. We both agreed on the fact that HPV is not spoken about. There's not enough known about it. And we knew that when we launched the HPV Alliance, that we could spread knowledge and save lives. Let's face it, there are huge gaps of knowledge about the HPV virus among the general public, among the patients, and even the doctors. And that's why we're here today for this very important event. Again, we want to spread knowledge and save lives. And on that note, I would love to introduce my very good friend, an awesome advocate, awesome everything, Marsha Cross.
Thank you so much, Lillian. You are the best thing that's ever happened to me. And if I had to go through cancer to meet you, then so be it, because together we are going to save a lot of lives, and that's worth it to me. Welcome, everybody, and thank you for being here. I'm really excited that today we're going to educate and hopefully answer some questions about the HPV virus. So thank you, Lillian, for starting the HPV Alliance. And today I want to thank all of our doctors and clinicians who are here to help answer your questions and who are giving so generously of their time in an effort to raise awareness and educate the entire public, I hope, about HPV. And away we go.
I'm very pleased to introduce our keynote speaker for today. Dr. Anna Giuliano is the founding director of the Center for Immunization and Infection Research in Cancer at the Moffitt Cancer Center in Tampa, Florida. Her career had its inception in the relationship between HPV infections and cervical cancer in women, and has evolved over the past 30 years to encompass HPV and penile, anal, and oral cancers in men. Her work has contributed significantly to our understanding of the rate at which HPV infections are acquired and cleared, the proportion that progress to disease, and the degree to which HPV vaccine protection is effective against multiple diseases in women and men. Dr. Giuliano was the recipient of American Cancer Society's Distinguished Achievement in Cancer Award and the Clinical Research Professor Award for Prevention of Infection-Related Cancers. In 2019, she received the American Society of Preventive Oncology Distinguished Lifetime Achievement Award. Dr. Giuliano has authored over 400 peer-reviewed publications and has been continuously funded by the NIH since 1990. We are so fortunate and honored to have Dr. Giuliano as the keynote speaker for today's event. I want to sincerely thank her for joining us to share her unique unique expertise in HPV and cancer. And now I bring you Dr. Anna Giuliano.
Well, Lillian, thank you so much for that wonderful introduction. So now we're going to move straight into the highlight of the session, which is eliminating these HPV-related cancers. But before we do that, let's kind of review what is human papillomavirus, or HPV. Now, hopefully most of you know that this is a very common virus. And in fact, around 80% of people will get HPV in their lifetime. The good news is that most people will clear the infection on their own. The bad news is that not everyone does, and we really don't know why some people will clear and some don't, and how to predict that. And unfortunately, 1 out of every 20 cancers is caused by HPV worldwide. So what are those cancers? Well, most are familiar with cervical cancer, but that is not the only cancer that HPV causes. And in fact, HPV causes multiple cancers in men as well as in women. And you can see here that what is in common for both men and women are cancers that of the oropharynx, that's the throat and the back of the mouth, anal cancer. And then among men, they also can develop penile cancer due to HPV. And for women can develop cervical, vaginal, and vulvar cancers. So all in all, there are 6 cancers that HPV causes in both men and women. Well, what does that look like here in the United States? For the women in the audience, you're probably very well aware that we have screening for cervical cancer. And that screening and treatment that follows has done a lot to reduce the incidence of cervical cancer in the United States. And in fact, what I'm showing you in this solid line is what that decrease has looked like over time. So it's slow, it's very progressively slow, moving down to a much lower level than what we had before. But what I'm showing you in the dotted line is the incidence of oropharyngeal cancer among men. And what you can see is it's going in the wrong direction. It's going up. And in fact, every year there is an increase in the incidence of HPV-related oropharyngeal cancer in men. And that increase is around 2.7% per year. So I kind of like to think of it, if we actually had our banking systems working well with interest rates, you'd say, oh, I'm investing my money, I'm getting 2.7% more per year. Except this is a cancer. And that is not what we want for cancer. It should go in the opposite direction. Now, there are a lot of reasons why that's happening, and I will talk about that in a little bit. But this virus, there are all these different types. So it turns out that human papillomavirus is one family of viruses, but there are many types. And in fact, those types cause different diseases. So most cancers are caused by these 7 HPV types that I've listed here. So for those 6 cancers, most are caused by these types. Probably the most important one for both men and women is HPV 16. So what happens when you get an HPV infection? Well, as I said earlier, these are really common viruses. So there's this initial infection that occurs. And most people are able to clear their infection completely. So that's the good news. And again, we do not know why some people continue with an infection. Why does it remain persistent? Now, for those who have persistent infection, a high proportion will develop, and in this case, cervical intraepithelial neoplasia, or another way of saying it is a high-grade cervical lesion that needs treatment. And if the woman is not going for treatment for this lesion, over time, that lesion will progress and develop into invasive cervical cancer. Now, in cervical cancer, the good news is we can interrupt that cycle. And we have several ways of doing it. Well, the first is that we have a vaccine. So that would prevent the infection to begin with. So these high-grade cervical lesions would never develop. But for women who have been past the age of vaccination, we have screening and we have treatment for those lesions that are screened positive. And in fact, even if a woman has been vaccinated, she needs to continue with screening and treatment based on provider recommendations. This is one of the most important messages that we can give. Yes, get vaccinated, but don't forget about screening and treatment, because it is the whole package that's going to help us to prevent cervical cancer and ultimately eliminate it. So what is this HPV vaccine? Well, most of what we have here in the United States is the 9-valent HPV vaccine called Gardasil 9. So it protects against 9 types. Now, I showed you these cancer-causing types before, but what I didn't show you yet is the 2 types that cause genital warts. And actually, genital warts are fairly common among both men and women. In fact, probably more common in men than in women, and causes a lot of anxiety, really difficult to treat. And you can imagine a lot of psychosocial distress. So the vaccine prevents 90% of those HPV-related cancers that I showed you, and nearly 100% of the genital warts. So this is a good news story for all of us. Okay, well, who should get vaccine? Well, all males and females ages 9 to 26. There's a routine recommendation for vaccination. What the public health authorities are trying to do is to target 11 and 12-year-olds, because there's this really nice package of adolescent vaccination during an adolescent well visit. So we'd like to get that vaccine at the same time that the adolescents are getting their other required vaccines. But what about mid-adult males and females? Great news, we have FDA licensure for the vaccine up to age 45, and the recommendation is to speak to your provider about getting the vaccine. So for adolescents, it's only a 2-shot series. For those 15 and older, it's a 3-shot series. But remember that 3-shot series or 2-shot series prevents up to 6 cancers as well as genital warts. We have plenty of evidence showing that the vaccine works. I'm showing you all the lovely flags from all the different countries that have demonstrated and published their results that the vaccine prevents the infections, the genital warts, the precancerous lesions, and now we have evidence that it will prevent the cancers, cervical cancer. So all in all, great news. So what can you do? Well, the first thing is to speak to your provider if you're a mid-adult age, and make sure that you have access to the vaccine and also for screening. And it's vaccine, screening, treatment, and prevention. We want everyone to get up to date to eliminate HPV-related cancers for yourself, for your family, and for your community. Everyone should consider vaccination in the age groups that I've shown you. And remember to think about screening and talk to your provider about screening. Here are the recommendations. If you're 21 to 29, it's a pap smear every 3 years. If you're 30 to 65, it's a pap smear with HPV testing or HPV testing alone every 5 years. Simple enough to do. So if we do that, and if we can get everybody on board, and number one is to remember screening and treatment, this really pretty green line shows what happens if we can get 90% of women screened and treated for these precancerous lesions. We will hit the WHO goal to eliminate cervical cancer as a public health problem by 2028. That's in 7 years. Come on, this is possible. We can do that. And if we continue, the green line shows us that we can get to near disappearance of cervical cancer, less than 1 woman diagnosed per 100,000 by the year 2063. That means for our children, our grandchildren, they will never see this cancer again. This is an important goal. It's a goal that the World Health Organization has taken on, and you can see all of the different organizations that have endorsed it and are partnering to make this happen. So where are we now in the United States? We're around 8 per 100,000 for cervical cancer. In 7 years, I'd like to see us get to 4, and soon thereafter to less than 1 per 100,000. And so I will leave you with that. It's a call to action for yourself, for your family, your community, and ultimately for the world. Thank you very much. And now I'd like to turn it over to Lillian Krappel and Dan Lifton of the HPV Alliance.
Thank you, Dr. Giuliano. That was amazing. You are such a fountain of knowledge on this topic. And what a great way to lay the foundation for the rest of the day. Thank you again for being here and for all the important work that you do. Let me first introduce my other partner in crime, Dan Lifton. It was about a year ago when Dan, Marcia, and I met at an event called People versus Cancer. Marcia invited us and a few other people up to her room where we sketched the plan to launch the HPV Alliance. Dan has been my angel. He has encouraged me to start the organization, and he is always by my side, helping me with everything to make this organization move forward and thrive. So let me turn it over to Dan to say a few words.
Thank you, Lillian, for your very kind words. Your optimism and courage in the face of your cancer diagnosis is really inspiring. So you're truly not just a survivor, but a thriver. And the same goes for Marcia. I don't have a direct personal connection to HPV-associated cancer, but as Patrick Dempsey said at that event we attended, everybody needs one cause that they can really work on. So this one chose me, since I couldn't resist the energy and passion that you and Marcia brought to this. So it's been an honor working with both of you. Our mission at the HPV Alliance is to spread knowledge to save lives. Spreading knowledge has a number of requirements, but the fundamental one is dialogue. In order to spread knowledge about HPV and HPV-related cancers, we need to be able to talk about them. And as a society, we're not doing nearly enough of that. Why? The answer is stigma. There's a stigma associated with HPV, which prevents us from discussing it. So the first thing that we need to do is to destigmatize HPV, and we can do that by educating people. Let me give you an example. One basic fact is that there are two types of HPV. The first is referred to as low-risk HPV. It causes skin lesions, so it's unpleasant, but it's not dangerous. The second, which we're primarily focused on today, is high-risk HPV, which can cause cancer. This type of HPV is dangerous, but it shows absolutely no signs of your body until it starts to do damage to your cells. And only then can it get detected, which is why we need screening to pick up the cell damage before it progresses to cancer. It is not herpes, which is an HSV infection. And once again, there are no visible signs. What that means is that you have no idea that you got it, or when, or from whom. You have no idea that you have it, or that you may have passed it on. You don't know if you got it yesterday, or a year ago, or 5, or 10, or 20. You or your partner could have used a condom and have still gotten it. You could have abstained from intercourse entirely and still have gotten it from other sexual activity, even deep kissing. Yes, this is not a myth. There are research papers that validate this. Where is the shame in any of this? We've had 28 million Americans who've had the COVID infection. Many of them passed it on without knowing. Should those people be ashamed of themselves as well? According to the Cleveland Clinic, there are approximately 79 million Americans currently infected with HPV. Shh, don't tell anyone. Let's not talk about it. Let those 25% of the American populations be ashamed and keep this on the hush. Here's another statistic from the Cleveland Clinic for you. About 80% of sexually active people are infected with HPV at some point in their lives, but most people never know they've had the virus. 80%. There's a great comedian on the circuit named Ali Wong, who has a skit where she says, if you're young and if you don't have HPV, you got issues. You really got to get out there, girls and boys, because men get HPV as well, just as much. When you say all of this out loud, doesn't it sound ridiculous that we have stigmatized an infection that a quarter of our population has right now through no fault of their own? We need to change this. To do this, at HPV Alliance, we have 2 active campaigns, which we're going to continue to ramp up in the near future. Let me share the first one with you briefly and then turn it over to Lillian to talk about the second one. Our first campaign is called Everyone Gets HPV, where we emphasize how pervasive this infection is and seek to destigmatize it. To learn more, you can go to our website, everyonegetshpv.org. Once again, that's everyonegetshpv.org, where we post some of the most basic facts about HPV. We're targeting younger people on that website in particular. So please do spread the word and let people know. And now let me turn it back over to Lillian to introduce our second campaign. Lillian, back to you.
Thank you, Dan. Well, we're very excited about this new campaign, and we are launching it today. In order to destigmatize HPV, we want people from all walks of life to share their HPV journeys. The way you can do that is by shooting a short video of yourself, sharing your story, and uploading your video on the share page that you'll find at the top of our website, hpvalliance.org. We'll then make it available for all of our website visitors to watch. If you're not comfortable doing that, you're not over the stigma. Get over it, get honest with yourself and others, and just talk about it. To show how it's done, I'm going to introduce our next special guest, Jamie Otis. Jamie, a dynamic American TV personality, registered nurse, entrepreneur, and TV host. Having jump-started her television career on the hit show The Bachelor, she was often recognized as the awkward girl. However, that all changed when she went back to film the TV show Bachelor Pad in the summer of 2012. In 2014, she was on the first season of Married at First Sight, and guess what? That's where she met and married her husband, Doug Henner. Then went on to share the first 2 years of their marriage on the show and documented their untraditional marriage on their YouTube series, Married Life. A dream of Jamie's was to become an author. In June of 2016, Jamie published her first book, Wifey 101, Everything I Got Wrong After Finding Mr. Right. Jamie is a role model because when she was diagnosed with HPV, she saw no stigma in it. On the contrary, she went out and told the world about it. That's how we learned about her. So we called her agent and asked her to join our social impact board. And guess what? She said yes. She is a fantastic, generous, and giving person. And she's the perfect inspiration for our HPV Journey campaign. And as I said, we wanted Jamie to show us how it's done. So we asked her to grab her phone, turn it into selfie mode, and just shoot. So here she is, the real Jamie Otis.
Hey there, my name is Jamie Otis, and I think that most people might know me from marrying my husband as a stranger on the popular TV show on Lifetime Network called Married at First Sight. I was also on The Bachelor, but that was such a long time ago, and we're not even gonna talk about that. So yeah, I would say that the reason that I wanted to be very honest about, oh, hi.
So I had to be very quiet.
Okay, Hendrix is sleeping, so we have to be very quiet. That's my daughter, Henley Grace. Yeah, you want to say hi and bye? You want to say hi? Hi. You want to say hi, baby? Yeah. Hi. Here, you got your bunny. Okay, Mommy's going to finish talking to all of our friends, okay? Okay. You can stay here if you want to. So I actually found out that I had HPV when I was pregnant with her. Fun story. I was like mortified because I thought that you only catch an STI if you have multiple partners. And I know that I've only been with, I'm actually, to be very, very honest, I've only had 5 different partners, including my husband. And I've only been with my husband for the last 7 years. So I was like, how on earth do I have an STI? And what's really sad about that is that I've been in nursing school. So yes, I was on The Bachelor, and yes, I'm on, I host a TV show now. But prior to this whole being like a public persona, I went to school to become a registered nurse. Okay, honey, go pee-pee. Go pee-pee. And I went to school to become a registered nurse. I specialized in labor and delivery, and I worked at the #1 hospital in Manhattan, Columbia Presbyterian. So it's not like I'm completely ignorant to, things healthcare related, right? But the issue with this, with HPV in particular, and why I want to be so, I guess, outspoken and like kind of share about my own journey so that hopefully I can help destigmatize just like the feeling of that you're dirty or you're promiscuous or you have multiple partners if you have HPV. The reason that I wanted to be so forward is because like if I am somebody who graduated from nursing school, worked as a registered nurse, and I wasn't aware of the fact that this STI affects so many people. I think they say it's what, like 1 in 5 people will catch HPV. Like, don't take my word for it. I'm sure there's a panel of people here who have better statistics than I do. But what I'm saying is that there are so many people who will have caught HPV at some point in their life. I think it's like over 80% of the population will. That's astounding. And the fact that those of us who have it don't want to talk about it and we hide in shame because we're scared that people are going to judge us and think that we're dirty or promiscuous or whatever the case may be. It's really, really, really concerning, because what happens if when we hide and we don't talk about these things is then we don't seek treatment. And if we don't seek treatment, bad things can happen, like cancer. And that leads me to my second pregnancy with my son. Eat time for out. My pregnancy with my son, I went in and I had, oh, there's my husband. Pregnant with my son, I had an abnormal pap, and on that pap, I'm pregnant, so I can't, get a whole lot done, and I ended up needing a colposcopy after I have my son. So I went ahead and, I did everything diligently the way I was supposed to. I went and I got the colposcopy, came back abnormal cells again. So I went to go have the LEEP procedure. I had 2 of the cone-shaped samples pulled out of my cervix, and the doctor sent it to pathology to see if they got all of the cells. And what I heard was that, yes, they got it all of the precancerous cells are gone, and I should be very happy, and I am very happy. And then I had a chat with some people at the HPV Alliance, and they're like, well, actually, just so you know, HPV can be dormant in your system, and you can actually, come back positive later. You can still develop like precancerous cells later, or at least like dysplasia later. And it's not like it's one and done, and you should definitely continue to get your paps just the way you're supposed to and stay diligent, because this comes back. It will run dormant sometimes, but it could come back. And so I just think that, first of all, what HPV Alliance is doing to help destigmatize HPV is astronomically astounding. Like, it's just so important. And I think that, those of us who have had HPV, and to share our stories, whether it be we caught it early and hopefully it's taken care of, and now we're just being more precautious about it. That's great. Or, Marsha Cross, who I am such a huge fan of, and the fact that she's been so vulnerable to share her story and just, everything that she went through. I think that is the best thing that we can do. Like, it's the best gift that we can give each other, is just our stories of success, of failure, of just our life experiences, so that hopefully we can help other people have better experiences in their life, or prevent illnesses from happening that don't necessarily need to happen. And that's what I was saying about HPV Alliance. It's so great, is that if we're sharing our stories and we're talking about HPV and destigmatizing it, maybe more people will reach out and get the treatment that they need, and not feel any sort of shame or embarrassment from it. But now that it's been about six minutes that I've been chatting with you about my story and why I love HPV Alliance, I actually wanted to, I know there's going to be some panelists who are very, very qualified to answer some questions. And I have a couple questions that I'm just really, really genuinely just curious about. I actually wrote them down. So I'm 34. Obviously, I know that I have HPV. I'm curious about the vaccination. I don't know how I feel about vaccinations in general, and I'm curious if you think that someone like myself would even qualify for the HPV vaccination. Should I consider it? Should I definitely get it? Why would I get it? And also, just to touch on that, I have a daughter, as you just saw, and a son as well. And we now also know that it does not affect just women. It affects men and boys as well. should they get the vaccination, and at what age should they get it? I mean, I feel like that's a lot of questions, but I'm dying to know your answers. And I have another question, just one last question. As a mom to young children, I need to be as healthy as I possibly can be. And I want to know, like, what do you recommend to optimize my immune system? Like, is there a certain supplement that you recommend, or is there a certain practice? I mean, I try my best to eat healthy, exercise, get daylight, sunlight, I feel like is so important. But what else could I be doing? All right, that is enough for me. Thank you so much for listening to my story and for taking my questions. And I'm looking forward to hearing what the answers are. Talk to you guys soon. Bye.
Let me sincerely thank Jamie Otis for sharing her patient journey with us. I hope that our panelists will be able to answer some of the questions that she posed as they help us bust various HPV myths, and God knows that there are many. I would now like to introduce members of our first Mythbusters panel, which will focus on the prevention and clearance of HPV infection. I have three distinguished panelists here with us today. First, we have Dr. Abraham Aragones, who practices internal medicine and engages in public health research at Memorial Sloan Kettering Cancer Center in my hometown of New York City. We also have Dr. Judith Smith, who practices medicine and actively engages in research at the University of Texas Health Sciences Center in Houston, Texas. Last but not least, we have Dr. Fatma Levent, the Medical Director of Pediatric Infectious Diseases at Advent Health for Children and the Clinical Associate Professor at the Department of Pediatrics at Texas Tech University Health Sciences Center. Thank you very much to all of you for being here. In normal times, we'd all be sitting at a long table on a stage, but these are no ordinary times. So I will be interviewing each of our panelists separately. So let me go ahead and start with Dr. Aragones. Dr. Aragones, thank you very much for joining us today. Let me go ahead and introduce you to our audience. Dr. Aragones is an internal medicine physician and public health researcher at Sloan Kettering Memorial Cancer Center here in New York. His areas of expertise include working with primary care providers to address barriers for cancer screening and prevention among minority and immigrant populations, specifically among the Latino population. He is currently working in the area of HPV vaccine practices among providers serving large minority populations, developing an intervention to promote the utilization of the HPV vaccine among children of Latino immigrants, and investigating a new model to disseminate and implement evidence-based practices to community physicians serving large Latino populations. Okay, let's get to myth number one. If you didn't get vaccinated in your teens, you missed your window. Once you're no longer a teenager, there's no benefit from the vaccine. Dr. Aragones, what do you say?
First of all, thank you so much for inviting me, Lillian, and for being part of the Alliance. I truly enjoy working with you and with the group, and this is a fascinating effort. There are plenty of benefits. So the vaccine is approved from ages 9 all the way to 45. The ideal is to get it before you become sexually active, so usually before your teens, before you get to the 20s. But if you don't get the vaccine at those ages, you can still get protected against HPV, a virus that causes cancer later in life, by getting this vaccine. So it is very important. There's a lot of benefits from getting this vaccine if you get it later age, even if you get it when an adult. So for example, I got it at age 42. If you get it at that age, you can still get the benefits of reducing some of the premalignancy lesions that you see, that you can find, and even certain types of cancer, like we'll discuss, oropharyngeal cancer or throat cancer. So it is very important that you get vaccinated and that you do know that there's plenty of benefits, even if you're not in your teens.
Thank you, Dr. Aragones. Let's turn to another myth. The safety of the HPV vaccine is unproven. The vaccine itself can be the cause of the virus. It can lead to neurological disorders, infertility, and even cancer. Getting the vaccine is just not worth the risk. Can you please bust this myth for us, Dr. Aragonis?
Absolutely. And this one is actually one that I truly enjoy having a conversation, because this is one of the safest vaccines that we have out there. So let me start by saying that once the vaccine is approved, we don't stop looking at the safety of that vaccine. We continue to look at any side effects, any potential side effects, or any potential issues that the vaccine can cause. And we have data for over 20 years now about the vaccine, and we know that it's extremely safe. So you might get some redness in the area, you might get some pain in the area in your shoulder, but other than that, it is very, very safe. Perhaps one of the safest vaccines out there. Now, you don't get the virus when you get the vaccine. It's parts that actually make your body produce these chemicals, antibodies, to protect yourself if you in the future are exposed to the virus. So you cannot get the virus nor cancer from the vaccine. Neurological disorders have been discussed in social media and other areas related to this vaccine. There is no scientific data that is actually true, none whatsoever. And it's not that it's anecdotal data, but we have actually looked at the indicators, and none of this has actually shown up in the data. As I said before, and I want you to remember this, is that we continue to look at the safety of this vaccine every day, and we analyze that data every year. So if there is actually a spike in any of these diseases, we will see it, and there is none. The vaccine is actually extremely beneficial, and the risk is minimal, very minimal. And by risk, I mean a little bit of pain, a few days of pain in your shoulder, and perhaps redness. That is the risk that the benefit is protecting yourself against cancer.
Dr. Aragonis, that's great and so helpful for us to hear. All right, on to the next myth. The HPV vaccine only benefits women and girls. There's no reason for men to take it. Can you please break this down for us, Dr. Aragonis?
Yes, so this myth comes from many years ago. It used to be that when we first discovered that HPV was associated with the cancer, the first cancer that we learned about was cervical cancer, and cervical cancer in women. So it was also thought that HPV was only affecting women. So men will have it and will just transmit it from one person to the other, but will not get any diseases, will not have any consequences from having that. Well, now we know that men are as affected as women when it comes to HPV and cancers caused by HPV. So as it was discussed previously, HPV can cause penile cancer, anal cancer in men and women, throat cancer in men and women. So this is definitely an issue within the male population. So the HPV vaccine protects against HPV for both men and women. And it is as highly beneficial for men as it is for women, or women as it is for men. So there's absolutely no difference whatsoever. Men are affected by this disease as much as women.
Fantastic. Thank you so much for clarifying that, Dr. Aragonis. This has been super helpful. Okay, let's move on to our next speaker. Dr. Smith, thank you for joining us. And now I'm going to introduce you to our audience. Dr. Smith is a professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences at UT Health McGovern Medical School and director of the Women's Health Integrative Medicine Research Program. She is also an oncology clinical pharmacy specialist at the UT Health Memorial Hermann Cancer Center. Previously, Dr. Smith was a faculty member in the Department of Gynecologic Oncology at the MD Anderson Cancer Center. Dr. Smith is board certified in oncology pharmacy and has published over 100 peer-reviewed publications, including book chapters, manuscripts, and abstracts. She's also the co-editor of the textbook, Women's Health Across a Lifespan, a pharmacotherapeutic approach. Her research mission is to advance the progress of the safe and effective use of nutritional products with pharmacologic modalities as it relates to women's health and cancer. Dr. Smith, Myth number 1, there's only one type of HPV and you know when you have it.
That's really not an accurate statement. There's actually over 100 different types of HPV, if you want to be technical. But what's more important for people to know is that there's both low risk and high risk HPV. So in the case of low risk HPV, there are signs and symptoms. Typically, patients will have outbreaks of lesions in the genital area that they can see and treat and hopefully clear that infection. It can come back, but overall, you can see the signs and symptoms of low risk HPV. Unfortunately, and what we've been talking about today is there's over 15 types of high-risk HPV that cause cancer. And this type of infection has no symptoms, no signs, no symptoms. You do not know you have it. You do not know you're passing it on, and it can cause cancer. And so that's what we've been focusing on today, is to really prevent that transmission of that high-risk HPV, because there's no signs until there's cancer, and those cancers can really be altering, as you've heard from all the patient stories, on how traumatic that and disruptive that is to everyone.
And then there's another myth here, myth number 2. How about when you hear, I always insist on using a condom, so I'm not at risk of HPV?
That's another great question, especially I get from our younger audience. And a lot of times when people don't understand when we say HPV is also a risk for head and neck cancers, and why is that? And it's important to remember HPV is transmitted by any skin-to-skin contact that's intimate, not just shaking hands, but intimate skin-to-skin contact. So it may just be with any kind of sexual contact. It can be from oral sex, it can be from intercourse, or anything in between. And so it's really important for especially our younger patients and kids to understand that it's not just intercourse and condoms, but any kind of intimate contact, how HPV can be spread.
Dr. Smith, let's turn to myth number 3. Nutritional supplements can never help you clear the HPV infections.
Okay, so historically, that is a true statement. However, about a decade ago, we started looking at a new unique supplement that is called AHCC, and it works in the body differently, especially against chronic infections like HPV. So we've recently concluded a double-blind, placebo-controlled study on AHCC, and that's a big word. What it means is, as the investigators and the patients on the study, we didn't know if they were taking AHCC or placebo, and the patients didn't know if they were taking AHCC or placebo for that. And we're able to show the HCC for 6 months was effective in clearing the infection initially, and for a long time, it didn't come back. So it was effectively cured for this study. So we're very excited. That data will be published soon, and we're really excited to continue to improve awareness of that option of taking AHCC in people who are already infected with HPV. The bottom line is, now we do have a nutritional supplement that has some promise and is showing benefits in clearing the HPV infection by strengthening the immune system.
Well, as you know, and as we met, I'm very familiar with AHCC. My gynecologist had me take it when my white blood cell count was low. I'm still taking it for my immune strength and health. And actually, I have Marcia and Jamie taking it as well. Is there anything that you want to add or that we should know about this supplement?
So HCC is readily available today, and there are a variety of reliable sources. And my key point to you all is to make sure when you're purchasing a nutritional supplement with HCC is to make sure it has that trademark or real symbol by it. Because unfortunately, over the past 10 years, as people have seen my research being published, a lot of counterfeit products have emerged. Anything that has things spelled out is probably not the legitimate AHCC product.
Okay. Well, that's very helpful. Thank you. I'm so delighted to have a pediatrician who specializes in infectious diseases on our panel. We've talked about vaccinating adults, but we need to talk about kids. It's a topic that I've discussed with both Marsha Cross and Jamie Otis. There are many misconceptions in this area, and I know that our audience really wants to know about this. Let me now introduce Dr. Levent. Dr. Levent is a board-certified pediatric infectious disease specialist and the medical director of pediatric infectious diseases at Advent Health for children in Orlando, Florida. She is also the clinical associate professor at the Department of Pediatrics at Texas Tech University Health Sciences Center, where she's been lecturing on a wide range of infectious disease topics. Dr. Levent holds certifications from the American Board of Pediatrics, including Sub-Board of Pediatric Infectious Diseases, and is a member of the Pediatric Infectious Disease Society and the Society of Healthcare Epidemiology of America. She always wanted to be a pediatrician and decided to pursue a career in infectious diseases because she wanted to be able to diagnose, treat, and prevent infections while exploring the wide variety of opportunities to improve health issues locally and globally. In addition to patient care, she has been involved in the education of medical students, residents, and fellows in the ever-changing field of epidemiology of infectious diseases. So thank you for joining us, Dr. Levent. Let's get to those myths. Myth number one, kids do not need to be vaccinated early before they're sexually active. I can just wait until they're teenagers, they're late teenagers. What do you say to that?
Thank you so much for having me. I appreciate you. And this is great that you're working on evaluating the myths, because it's very common. And this is one of the very common myths, that everybody thinks that they don't necessarily have to be vaccinated early. However, getting to them earlier before exposure actually creates really good prevention for HPV infection, which is one of the most common sexually transmitted infections. And the earlier you get to them, usually the common ages that we give it as 11 to 12 years of age, they need only 2 vaccinations. And if they get to wait after 15, their immune system works a little bit differently. So they need at that time 3 vaccines. So if we can get to them earlier, it's going to be easier, less vaccines, and more effective.
Wow. Well, thank you, Dr. Levent. That's very helpful. What about the myth number 2? I don't need to vaccinate my son. The vaccine can only be given to girls.
And that's another common myth as well. So initially we started giving HPV vaccine to girls, and that's where it starts. And we know that it protects against cervical cancer. However, there are many other cancers that it protects for our girls and also our sons, our boys, that we can give the vaccination to. So right now it is recommended for both boys and girls.
Okay, thank you, Dr. Levent. How about if I vaccinate my kids, they will wind up engaging in sex earlier, and that is something that I don't want to encourage?
And that's actually one of the earlier myths that with multiple studies, we have shown that that is not true. And I can give examples of my own kids. I have 3 kids who are all fully vaccinated with HPV vaccine, and they're adolescent ages. They don't even need to know much about why they're getting it other than this is a cancer prevention vaccine. And even if they didn't appreciate the shots, they appreciated that they were vaccinated against a cancer-causing disease.
Well, that's great. I'm so glad you brought that up. And then lastly, what do you say when people say, I don't need to bring up the HPV vaccination with my pediatrician? They'll tell me about it if they think I should get it.
So, most of the time your pediatrician should be bringing it up. And whenever you're going for your well check at 11 or 12 years of age, usually you would get the meningitis vaccine, the Tdap, which is the tetanus diphtheria vaccine, and the HPV. And sometimes pediatricians might give you an option for HPV. However, they should strongly recommend it. But you should also bring it up if you have any questions. I think it should work both ways, but it will be great to discuss and see if there are any questions or concerns about it and get it addressed.
Dr. Levant, how about this myth? I didn't vaccinate my children in their early teens, and now they're older and sexually active, so it's too late for me to vaccinate them.
I would say it is not late. There are multiple different serotypes of HPV that are circulating, and the vaccine provides a very good protection against multiple of them. And Gardasil 9 is now approved up to age 45. So it is recommended if they're at high risk to go ahead and vaccinate.
Thank you so much, Dr. Levant. Thank you for dispelling and busting all these myths today.
Thank you for having me. I appreciate it.
I'm going to share with you the highlights of my experience with anal cancer and how it was detected. I was well overdue for my gynecological examination, and I was making all kinds of excuses not to go because I felt like I had just been there. But as life would have it, it had been 14 months. So when I went to see my gynecologist and she was doing her exam, and we were chatting away as we always do. She did a digital rectal exam, which is part of her practice with her clients, and said she felt something that she didn't like. I thought nothing of it. I got on my phone and was texting away. She left the room. She called another doctor. I went to that appointment right afterwards, still not thinking anything except that, oh my God, I'm going to miss my daughter's basketball game. I spoke with that doctor briefly about our kids and Halloween costumes. She examined me, then looked at me and said, I just want you to know that whatever it is, it's curable. At which point I left my body. And then after a series of biopsies and a colonoscopy, it was determined that I had stage 2 anal cancer. I have to say I was in denial for a long time because it took a while to get the biopsy to be clear that it was cancer, although everybody suspected it was. So I'm going to just stop right here because to me, the most important thing about my story is that I had no symptoms. I had never had an abnormal HPV test. And if my gynecologist, Dr. Nancy Goldman, had not done a DRE, I would have skipped on my merry little way and it could have turned into stage 3 or stage 4. I don't spend a lot of time thinking about what could have happened, but I mean, emotionally, but obviously I know. So that, and the fact that 10 years prior, my husband went through throat cancer, HPV related throat cancer, made me go, what is going on? There's a virus. My husband had it. I had it, even though it never showed up on my pap smear. Table all this, I go through my treatment, which is pretty standard because it hasn't been changed in the last 30, 40 years, I don't know. Radiation, chemo, and came out the other side. And even then, I was still not sure what was going on. How did I get this? Probably like most people feel when they get something, any kind of cancer, but certainly anal cancer. And then of course it was anal cancer. I don't know, I think I wasn't working enough. I guess God wanted me to take on that role of being the anal cancer spokesperson, which frankly, I was not that interested in doing, but I started reading online that all of these women were lying and ashamed and not telling people what was going on with them. I had friends write to me after I went public and telling me they had HPV and they had hysterectomies or procedures, and they were lying to their husband's family. And there was all of this shame. And let me tell you, I have shame about a lot of things, my messy office that I'm looking at right now, but I thought, I'm not ashamed that I got this virus and that I have cancer. For God's sakes, it's bad enough to get cancer. Why should I walk around with shame about it? So anyway, lucky me, I meet Lillian because she reached out to me and she is a tour de force. I am actually much more of an introvert, and she is a brilliant, beautiful, ebullient, that's how you say it, extrovert, and a powerful woman. And together we are just determined to move the needle on educating people about this virus, finding out about early prevention and making sure that happens, whether it's with a gynecologist, in a dentist office, in the doctor's office. And so my story, in terms of the cancer, isn't interesting. It's awful. It's a terrible cancer. The only thing worse is throat cancer. So what I got from it is a beautiful friend and a chance to make a difference in, that's what gets me emotional, in people's lives. And to make sure that somebody doesn't go in and get a stage 3 and a stage 4 diagnosis that is much harder to treat. So my cancer story is really about my post-cancer story. Okay, so that's why we're here today. And I'm so grateful to the doctors and Lillian for putting this together. And I hope if you're watching, you learn something, you advocate for yourself. If you're a doctor, I hope you up your ante on educating other doctors and really, really being a warrior for eradicating the ignorance about this virus and the stigma. That's so silly. I mean, we all got chickenpox at one point, you know, oh God. Anyway, that's my story. I'm sticking to it. I thank you all for listening.
Wow, Marcia, thank you so much for sharing your story so openly. You are so brave. That is a very hard act for me to follow. Fortunately, I don't have much of a speech to give. Rather, my job is now to introduce the moderator of our next panel, and I'm so delighted that she could join us. Dr. Shannon Christie is an assistant member in the Department of Health Outcomes and Behavior at Moffitt Cancer Center and holds a secondary appointment in the Department of Gastrointestinal Oncology. In addition, she is a member of the Center for Immunization and Infection Research in Cancer at Moffitt Cancer Center. She also holds a courtesy appointment of assistant professor in the Department of Oncologic Sciences at University of South Florida in the Morsani College of Medicine. Dr. Christie is a behavioral scientist whose research aims to improve public health and reduce cancer disparities by increasing cancer preventive and early detection behaviors. We asked Dr. Christie to be a moderator today, which means that she'll be the one asking questions rather than answering them. But given that her research focuses on reducing cancer disparities, which is such an important topic in today's world, I thought that we need to take a break, that we need to break the rules a little and ask Dr. Christie to answer one important question for us before she starts with her panel. Dr. Christie, can you please tell us if there are any health disparities related to HPV-associated cancers, such as cervical cancer, for example?
Thank you, Lillian. I appreciate the opportunity to address this important topic. Unfortunately, yes, we do see a number of health disparities in the context of HPV-related cancers, including disparities in prevention and early detection, in number of new cases, and in outcomes. For example, in the context of cervical cancer, non-Hispanic Black women, American Indian and Alaskan Native women, and Hispanic women are more likely to be diagnosed with cervical cancer compared to non-Hispanic white women. Non-Hispanic Black women have the highest rates of cervical cancer mortality in the United States. In addition, we see disparities in cervical cancer screening among people who lack health insurance, those who have fewer financial resources, those without a regular health care provider, and among sexual and gender minority individuals. It's important to consider that these disparities can also be geographic. For example, we see a higher burden of HPV-related cancers as well as lower HPV vaccination rates in the United States, the southeastern part of the United States, compared to other areas. Women living in rural areas have higher rates of cervical cancer than those who live near a city or in the suburbs. I've listed several disparities, and these are just a few of the disparities found. And many of these disparities are due to barriers in accessing high-quality preventive care and treatment that are experienced by medically underserved and marginalized groups. Also, many of these factors can overlap, possibly making the disparity even greater. For example, as a whole, Black and Hispanic women are also less likely to be insured. So there's still a lot of work to be done to overcome these disparities and ensure equitable access to high-quality preventive care, early detection, and treatment.
Thank you, Dr. Christie. I really wanted to address this question during today's event, so thank you for lending us your expertise on this very important issue. And now, let me turn it back over to you so that you can introduce our second Mythbuster panel.
Thank you very much for the introduction, Lillian. It's my privilege to moderate this panel. Let me briefly introduce our three panelists before I sit down one-on-one with each of them. Dr. Paul Romiser is a radiation oncologist at Memorial Sloan Kettering Cancer Center with expertise in using advanced techniques to treat cancer. Dr. Ann Lin is an associate professor of surgery at David Geffen School of Medicine at UCLA and is a practicing colorectal surgeon at the UCLA Department of Surgery. Dr. Stephanie Blank is the Director of Gynecologic Oncology at the Mount Sinai Health System and the Director of Women's Health at the Blavadnik Family Chelsea Medical Center at Mount Sinai. Thank you very much to all of you for joining us today. Let me go ahead and poll Dr. Romiser for our first myth-busting session. Dr. Paul Romiser is a board-certified radiation oncologist at Memorial Sloan Kettering Cancer Center with expertise in using advanced techniques to treat cancer. Dr. Romiser is also actively involved in cancer clinical trials. He works to take ideas developed in the lab and translate them into actual trials and treatments that can benefit people with cancer. Dr. Romiser is a member of the NRG Oncology Colorectal and Non-Colorectal Gastrointestinal Cancer Committees. His work has been published in Nature, Science, Lancet Oncology, Clinical Cancer Research, International Journal of Radiation Oncology and Biophysics, and Cancer.
Thank you, Dr. Christie, for that kind introduction.
Thank you so much, Dr. Romiser, for joining us today. And now it's time to bust some myths. So let's talk about some myths that you have found that patients have about HPV-related cancers. So one myth is that HPV causes cancer by immediately entering your cells and making them replicate uncontrollably. Can you speak to that?
Yeah, great, thank you. I mean, it's common myth that patients hear about is that you're going to get HPV and you'll immediately develop this uncontrolled replication or uncontrolled cell growth. But what often happens with HPV infection is that the HPV comes into the body, infects the cells, and in most patients, it's actually, those cells are then cleared by our natural intact immune system. So most patients won't notice anything really at all. It's really in this subset of patients where the immune system doesn't clear the virus from the cells that the virus is able to come in, fully integrate into the genome, hide within our bodies, and subsequently reemerge later as a driver of cancer. So that period actually takes 10 to 20 years for cancer to develop. That's what the estimates are. So that actually gives us a period of time where we can intervene potentially and look at ways to stop or prevent cancer early in its developmental track. So it's really this kind of continuous period of development over these years where it can take HPV infection going from infection all the way to cancer.
Okay, thank you so much. So the second myth is that if someone has HPV, that the only cancer they need to worry about is cervical cancer, and that the other HPV-related cancers are rare and curable.
Yeah, so HPV can cause a variety of cancers, but certainly HPV is an incredibly strong driver of cervical cancer. In fact, over 90% of all cervical cancers are caused or related to HPV infection. And that's part of the success of not only the pap smears, but also in recent vaccination strategies have been shown to really decrease our rates of cervical cancer here in the United States and in other countries that have advanced screening as well as immunization programs. In addition, though, HPV can cause other cancers that are really significant for us as individuals, as a society. This can be oropharyngeal cancer or head and neck cancer. It can be additional cancers specific to men or women. So in women, you can develop vulvar or vaginal cancers. And in men, you can also develop penile cancers. You know, the head and neck cancer, the oropharyngeal cancer, that's increasing in incidence. So that's actually the most common HPV-associated cancer currently being diagnosed, and the incidence rates are increasing. And so that's a major public health concern, because now we're seeing that more and more men and women are coming in with oropharyngeal cancer. Now, certainly oropharyngeal head and neck cancer is more common in men than in women, but affects both genders and has a significant burden on our overall disease status in the United States. And hopefully all these cancers are going to be eliminated or significantly decreased with the advent of strong vaccination programs, as well as hopefully screening programs that are coming soon.
Thank you. And as we know, also anal cancer rates are also increasing. All right. And then another myth that we need to bust is that no one really knows what causes cancer, especially these HPV-related cancers, and that there's no proof, in fact, that these cancers are caused by HPV. Can you bust that myth for us?
Yeah, well, we have a lot of evidence that these cancers are caused by HPV. One, we see an incredibly high rate of HPV detection in these cancers. In cervical and anal cancer, that's over 90%. In other cancers, it's even greater of 70%, like oropharyngeal head and neck cancer. Two, we can see that the viral protein, as it integrates into our DNA, can produce proteins that inactivate two major tumor suppressor genes that we know are heavily involved in guarding our bodies against cancer. So it actually inactivates the p53 tumor suppressor gene and the retinoblastoma tumor suppressor gene. And while the specifics of these genes are really kind of beyond the scope of our discussion today, they are two major programs that help us eliminate or prevent cancer from forming in our natural cells. And by inactivating them, you're kind of removing our two guardians who are protecting our genome or our DNA from alterations that can cause these cancers. And so it's inactivating two of our major guardians against cancer, essentially. And another line of evidence is showing that when we look at patients who are vaccinated against HPV, we now see a dramatic reduction both in precancerous lesions, as shown in a US study looking at precervical high-grade lesions of the cervix. But more recently, in a Finnish study, they found that when they compared vaccinated teenagers with unvaccinated teenagers, that there's a reduction in rates of cancer, both in cervical cancer, vaginal cancer, any HPV-related cancers. And while the numbers were low, this is really the first evidence showing that HPV vaccination can decrease cancer formation.
Great, thank you so much. And then another myth for us to bust is the myth that only women need to worry about HPV-related cancers, that males are not affected. Can you speak to that?
Yeah, thanks. So men and women are affected by HPV-related cancers, but it's the cancers that come more frequently in men may not be the cancers that come more frequently in women. So while women the most common HPV-related cancer is cervical. In men, it's predominantly oropharyngeal head and neck cancer. So over 70% of HPV-related cancers in men are oropharyngeal head and neck cancers. That's followed distantly by second being anal cancer and third being penile cancers. So certainly it affects men and women equally, albeit differently. And while there's no active, as you said, screening ways to detect these are currently works in progress where patients who we know have high risk either behaviors or other high risk factors that make them at increased risk for developing HPV associated cancers. These are populations that there's currently active work in looking, can screening help reduce either cancer formation or help reduce or identify cancers at an earlier stage to make them more treatable. And so certainly there's benefits and should be concerns for men and women alike in terms of, one, getting HPV vaccination, and two, making sure you're being appropriately screened and monitoring for HPV associated cancers.
Thank you. I'm so pleased to introduce our next panelist. Dr. Stephanie Blank is the Director of Gynecologic Oncology at the Mount Sinai Health System, a professor at the Icahn School of Medicine at Mount Sinai, and the Director of Oncology Programs for the Blavatnik Family Women's Health Research Institute. Dr. Blank specializes in the treatment of patients with ovarian, cervical, and uterine cancers, and the care of women at increased genetic risk for gynecologic cancers. She serves on the Ovarian Committee of the National Cooperative Group, NRG, and is broadly published in peer-reviewed journals and textbooks. Welcome, Dr. Blank.
Thank you.
So the first myth is that if you had a pap smear 2 weeks ago and you haven't heard back from your doctor, not to worry about it. It means you're good to go for the next year. Can you please address that myth?
Well, I don't think, no, that's a myth. No news is not good news. We don't work it that way with pap smears. I think just getting the pap smear will not screen for cancer. It's really getting the pap smear, knowing the results and acting on the results. So it's actually really important that you do find out the results of your pap smear. And oftentimes it's not just the pap smear, it's the pap smear plus the HPV result. And you need to know both of those things. And I would encourage people that are listening here to actually, if you haven't heard about the result within 2 weeks of getting a pap, I would call your doctor's office and get that. That's your information and you should have it. You should know it.
Thank you. A second myth is that after a normal pap smear, that means that you definitely don't have cancer that's HPV related.
Well, that's not necessarily true. I think that, sometimes a pap smear can be, they're not perfect. They're not 100% perfect. Sometimes, especially in certain types of cancers, the pap smear doesn't pick them up that well. That's one of the reasons why we have both cytology, which is what a pap smear is, and HPV screening. People also think that a pap smear screens for all kinds of gynecologic cancers, and it clearly doesn't. It does if you can still have other, even non-HPV associated cancers with a normal pap smear.
All right. Our third myth is that after an HPV vaccination, women don't need to worry about having a pap test.
Again, it's another myth. Even though getting the vaccine is the best thing that you can do to prevent cervical cancer and other HPV associated cancers, and I encourage everyone to do that, you still need your screening. You might have been previously exposed and not know it. You can still be exposed after having the HPV vaccine. So the screening at this point in time for people that have had HPV vaccine is exactly the same as people that have not had the HPV vaccine.
And then another myth is that after someone has found out that they have HPV, it means that their partner must have cheated on them. And that's the proof that they've done so.
Yeah, I hear that often. When you get HPV, you have, once it's detected, rather, it doesn't give you any information about the time in which you got it. So it could have been years ago. You can't really blame it on the last person that you were with. And I think that's actually really important that people know that.
Thank you so much, Dr. Blank. All right. And another myth, Only women can pass on HPV, so men shouldn't be blamed for it.
Great question. Many more women probably know they have HPV than men because women get pap smears, but men are just as likely to pass on HPV as women are.
So another myth to address is that a woman doesn't have to worry about getting regular pap tests if she's had the same sexual partners for a number of years.
Yeah, that's a myth as well. Even if you have the same partner, you may previously have had HPV, you may also get new HPV. And actually, with HPV takes some time to cause the changes, and they're gradual changes that happen to cause cancer. So you really do need to continue to get tested and looked at over time, even if you have the same partner. It's not only what's happening today, it's what's happened in your whole life. And also in your partner's whole life. So it's really very important that you continue to get checked. It's pap smears are work because you get to see things over time, and you get to see how things progress and change. And it's wonderful that you've had the same partner for 15 years, but you still need your pap smear.
Dr. Ann Lin is an associate professor of surgery at David Geffen School of Medicine at UCLA, a practicing colorectal surgeon, the director of quality for the Division of General Surgery, and the medical director of telehealth programs for UCLA Health. She is the recipient of several awards for clinical excellence, including Top Doctor by Castle Connolly and Super Doctors. Her clinical interests and expertise include colorectal and anal cancers, minimally invasive colorectal surgery, inflammatory bowel disease, HPV, and anorectal disorders. Dr. Lin is a member of the American Board of Colon and Rectal Surgeons and is actively involved with the American Society of Colon and Rectal Surgeons. Welcome, Dr. Lin. So let me now go ahead and kick us off with our first myth for Dr. Lin. So myth number one is that if someone has rectal bleeding, it must be hemorrhoids and not to worry about it too much.
The majority of the causes of rectal bleeding are likely benign, but it is also a common presenting symptom for serious conditions. The anal canal is about 3 to 4 centimeters long, and it's surrounded by sphincter muscles. Rectal bleeding can be caused by swollen blood vessels called hemorrhoids, or tears in the anal tissue called anal fissures. Sometimes bleeding can be caused by an inflammatory condition or polyps or lesions in the colon and rectal or anal region, as well as cancer. So it's important to look at your stool and toilet paper and let your medical provider know if you have bleeding. You'll be asked about other symptoms such as pain, drainage, itching, tissue prolapse, unintentional weight loss, narrowing of stool or changes in bowel habits, abdominal distension or pain, family history, and whether or not you've had a prior endoscopic exam of your intestine. Although rectal bleeding is the most common initial complaint in patients with anal cancer, half of patients with anal cancer may not experience rectal bleeding. 1/3 of patients may experience anorectal pain or sensation of a mass, and 20% of patients may not have any symptoms at all.
Thanks, Dr. Lin. Now on to our next myth. So the myth is a digital rectal exam, or DRE, is painful and unnecessary. What do you say to that myth?
I think a digital rectal exam can be performed without causing discomfort if it's done well. Typically, I start with a visual inspection of the skin to look for certain conditions where it might be uncomfortable to perform an exam, such as an anal fissure or a cut in the anal area. We use lubrication to be sure that we don't cause a lot of discomfort. And if there is a lot of pain, then an exam under anesthesia where there's some sedation could be performed for diagnostic purposes. When patients don't have discomfort, such as an anal fissure from an anal fissure. An anal exam with an anoscope can be performed fairly easily. We talk the patients through it, and it can be done easily without sedation.
Thanks so much, Dr. Lynn.
Marsha and I have been very blessed to have found wonderful advisors who've been helping us in so many ways. One of them is Andy Ackerman. Andy was the executive director of the Children's Museum of Manhattan for 29 years and has done amazing things for the museum. He knows a tremendous amount about the world of nonprofit organizations and has taught us everything we know. So today, I asked Andy to do what he has done many times before, to help us communicate how you can help us and to announce some unexpected and very exciting news. Here is Andy Ackerman.
Thank you, Lillian. That was an incredible panel. The HPV Alliance is really a special and unique place. Its co-founders, Lillian Krapel and Marsha Cross, both have had cancer due to the virus. They know the trials and tribulations of diagnosis and treatment and bearing with a lot of unknowns. They know what it's all about. They are the authentic people running an organization to help you. And now they have an exciting announcement to make. My favorite actress, Marsha Cross, has made a $10,000 grant that's a matching grant. So it needs to be matched with $10,000 of additional money. And here's what it can do. For every $1,000, we can reach 1,000 people. So with $20,000, we can reach 20,000 people. And with education and treatment, 3,000 of those people will be spared living with the HPV virus and its consequences. So we need you because it's kind of simple. Every $1,000 means 1,000 people learn more about the HPV virus. So $1,000 equals 1,000 people. Now we can go beyond $10,000 in gifts, and it only increases the amount of people that we'll be able to treat. So it's really up to you to make a huge difference in people's lives. Now, Marsha started this. It's her initiative. Don't cross Marsha. Working together, there'll be no desperate housewives and no desperate house husbands having to live with HPV. So let's do it now. Go to hpvalliance.org/donate and make your donations now. Remember, don't cross Marsha, and together we can bring the message of education and treatment to thousands of people. Thanks, and I'm going to reintroduce my good friend, Lillian Krapel.
Thank you, Andy, and thank you to all of those who are able to help. Please donate at our website, www.hpvalliance.org. You'll see the donate button at the top of the page. Let me start my closing remarks by thanking everyone who made this event possible. First, thank you to Moffitt Cancer Center and Advent Health for helping us organize this event. We really appreciate all your time and effort, including providing some of the wonderful speakers today. Second, thank you to my partners in crime, Marsha Cross, Dan Lifton, and Danielle Riley-Weed, who have helped us plan this event and have been integral to Marsha and I launching and building the HPV Alliance. They are also members of our executive board. Apart from their other contribution, I want to give a special thanks to Marsha for her incredibly generous donation to the HPV Alliance for a second year in a row. I also cannot tell you how much time Dan and Danielle spent in preparing for this event, nights, weekends, you name it. Thank you for all your support and incredible generosity. Kudos to Maypro and Mediatonic for having such amazing leaders. I want to thank our advisors, Andy Ackerman, who spoke to you earlier, Marcy Reeder, Lauren Dillon, Shazia Ahmad, and Melissa DeFries. Let me also thank my amazing medical advisory board, many of whom joined our panel today. These are some of the top doctors in the country who are incredibly busy, and they're still generously volunteering their time to the HPV Alliance. I'm extremely grateful. And a shout out also to Rebecca Jobson, who is helping us build the bridge for HPV Alliance to the United Kingdom and Europe. Next, let me share our appreciation to our corporate benefactors that you see here. In particular, I want to thank one of our main sustainers, Quality of Life Labs. They are a nutritional company that is committed to following the core principles of Western medicine by relying on double-blind placebo-controlled studies to verify the efficacy and safety of their products, which is rare in the supplement industry. I take their product for HPV and have gotten both Marcia and Jamie on it. So I'm very passionate about what they do and how they do it. A special shout out also to Amino Up, which is an amazing medical nutrition company in Sapporo, Japan. I've gotten to know their team personally, and they are lovely people with a mission to bring smiles to the world and an affinity for Shake Shack burgers. Thank you also to Maypro, Trade Pia, and my good friends at Athleta, a great women's activewear brand which really gives back to society and is a registered B corporation. Boundless thanks to Mediatonic, one of the best PR firms out there, and their CEO, Daniel Riley Weed, who worked tirelessly to make this event happen. Thank you, Danielle. I also appreciate our media sponsors. YourTango.com is a wonderful website with very engaging content, particularly on women's issues and relationship issues. And its founder, Andrea Miller, wrote a great book called Radical Acceptance on Making Relationships Work, which you should all buy on Amazon. Thank you also to healthywomen.org and Patient Resource. Both of these organizations do very important work of empowering both healthy and diseased people to self-advocate and make informed health choices. Thank you also to all of our mission partners, the incredible organizations and their leaders with whom we've closely collaborated with and who help spread the word about this event. The Farrah Fawcett Organization, Anal Cancer Foundation, Survivor, Cancer Care, Vax2Stop, High Sierra AHEC, the New York State HPV Coalition, NHS Lancashire Teaching Hospitals, all the way from the UK, and Plan Heal, an innovative technology company that develops apps to improve human health. Also, I'd like to thank Merck and their amazing staff who provided an independent, unrestricted grant which helps us educate patients on a variety of different topics related to HPV and cancer. Now, more than ever, we should all appreciate the importance of the work that scientists and researchers at companies like Merck do in studying and developing life-saving vaccines. I have met many people at Merck at various conferences, and I can tell you that these men and women are genuinely passionate about curing diseases and improving human health. And whether you're talking about anti-cancer vaccines or life-saving therapies available to you as a cancer patient, as they were to me, you say, thank God that these people have done this work, which saved my life. I'm so grateful to Steve for helping us tremendously since our early days, and to Susan for her contribution to patient advocacy. Let me conclude with a tribute to someone who became a dear friend. Shortly after I finished my treatment at Memorial Sloan Kettering, a man named Paul reached out to me after seeing my video on the hospital's website. He also had cancer. Unfortunately, he was at a much later stage than I ever was. We became friends and we shared our personal journeys. He called me his hero, but in actuality, he was the hero. I have never met anyone who is so positive and upbeat, yet stage 4 cancer. Paul was a podiatrist who maintained very close relationships with his patients. They were like his family. He shared their joys and their sorrows. He took care of their feet and he nourished their souls at the same time. As Paul's cancer progressed, he was forced to shut his private practice. Between chemo, radiation, and surgeries, it was too much to keep up with. But he strongly wanted to continue serving the community and to be available as a resource for other cancer patients. He confronted his disease from both the perspectives of patient as well as a doctor. He had such an empathetic nature. We first met last year at the People vs. Cancer conference here in New York. We had been communicating all that time and never had met until then. During the last few years of his life, he volunteered to be a cancer peer support counselor at BOLD, Bronx Oncology Living Daily, a psychosocial support program based at a Montefiore hospital. He cared deeply about Israel and loved his time spent there for education and vacation during his life, most recently in January 2020. That was the most amazing gift that he was able to do, to take that trip during his incurable phase of the cancer. I miss talking to Paul, and I miss his amazing spirit. And now that you have learned, please help us spread the knowledge. The recording of our event will remain on this page, so please share the link with your family, friends, colleagues, and anyone you know so that they too can learn about this life-saving topic. Once again, if you're willing to share your HPV patient journey like Jamie, please video record yourself and upload it on the share page of our website, hpvalliance.org. If you'd like to make a contribution to our organization, please go to the donate page on our website. If you registered, we will keep you posted on our future events and projects. If you want to receive our newsletter, please email us at help@hpvalliance.org. Please also like us on all social media platforms. Thank you for joining us today. Through your participation, you have made the world a healthier place for you and for others whom you can help educate. Spread the knowledge, save lives. This is our mission, and we hope that it can be yours as well. Please stay safe. And once again, thank you to everyone who helped make this event happen. We'll see you again in the very near future.